There is a condition that is called metabolic syndrome. Metabolic syndrome. It occurs if you have any three of these five diseases. Number one is hypertension. Number two, diabetes. Number three is obesity, the truncal obesity. That type that used to cause men or women to have big tummy. That is number three. Number four is bad cholesterol. In that number four now, in that bad cholesterol, you have two forms of it. Bad cholesterol, whereby you have low level of the good cholesterol, which is called the high density lipoprotein, or you have a high level of TG, triglyceride, so making it 5. So bad cholesterol, you have low level of the good one, or you have a high level of the bad one. So if you have three of these, you have a condition that is called metabolic syndrome. The problem about this condition is that they usually go together. That is why whenever you have somebody that has hypertension, usually that person will have diabetes. Or if you have somebody that is obese, that has truncal obesity, that is abdominal fat, so much abdominal fat, they are usually hypertensive and they usually have heart problems. So now, as an individual, look at yourself. If you have hypertension, the chances of you having other metabolic disorders, they are also there. Now, the importance of this message is to make you to understand that all these diseases, they are bound together by a condition that is called resistance to insulin. Resistance to insulin. That is why people that have diabetes, especially type 2 diabetes, they are usually obese, big body, usually have a big body, overweight and obese. But you can actually counteract the effect of metabolic syndrome if you know about it. If you know about it, what do you do in order to reduce the resistance to insulin? Resistance to insulin means that your body is pumping a higher level of insulin in order for your body to react to insulin. Your body is not receiving insulin very well, so it needs a higher level of insulin to act. That is why in your system you have a high level of insulin circulating. That is called hyperinsulinemia. That's what happens in metabolic syndrome. Now, if you have this condition, if you have hypertension or diabetes or two of it, the only way to counteract it is by exercising. That is why I talk about aerobic exercising all the time. Aerobic exercising is one of the ways that can help to fight against this condition that is called metabolic syndrome. It runs in the family. There are some families you go to, you will see that a papa is hypertensive and diabetic. Likewise, the children. So if you are an individual and you are seeing this video, one thing I want you to learn is that there is a condition that is called metabolic syndrome, and you can actually have it. However, you can counteract the effect of this metabolic syndrome by doing aerobic exercises, something like jogging, playing table tennis, playing football. Exercise helps to counteract the effect of hyperinsulinemia that occurs in metabolic syndrome. If you understand this message, it will help you a lot in your management of your life, your lifestyle. It will help you also in management of your medical conditions. So if you see this message, please help to share it to other people so that they will learn about this condition. Thank you so much.